Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Welcome back to Between Two White Coats. I have Michael Bruner here, one of our nurse practitioners, and we are talking about a very hot topic, Semaglutide and Tirzepatide. And today we are going to go through with you tips and tricks to successfully navigate these weight loss programs. Lots of people are doing it, available online, available in person.
Yep.
We have a program that we're very fond of that includes lifestyle change and a number of other things to really help people succeed.
Yeah.
Because we've realized that the drug itself is it's not just the magic. There are other things.
Yeah.
So we want to take you through some of the tips and tricks that we give people to help them to tolerate the medicines better if they're having side effects and to get the most out of the medicines.
Right.
So let's talk about the bad stuff first. What if
Okay.
you're struggling to tolerate these medicines? What are some tips and tricks for that?
Yeah, so I think one of the things that sets our program apart from some of the others is it was built with a clinical mind, with a clinical background. So for some of our patients who do have some of these side effects and maybe not tolerate the medications as well, we are able to prescribe medications to help with nausea or diarrhea and things like that. But then also in that clinical knowledge base, there's certain foods you can avoid, like a lot of fried and fatty stuff that can help mitigate some of those GI side effects and things. And so I think one thing that's important is if you are going to take these medications, it is working with a medical provider to make sure that you are taking them safely, effectively, and then to get the most out of them.
Yeah, absolutely. So one of the things that I always hate in medicine is when we give a medicine because of a medicine, and then we give another medicine because of a medicine. But here it's super appropriate because most of the time these are limited side effects. And so taking a medicine like Zofran, the generic being ondansetron, to help with some of the nausea, because you get the nausea on day 2, and then by day 3 or 4 it's gone.
Yeah.
So maybe just a little pill to help. And then on your second and third shot, you may not even have the nausea.
Right.
So it's super helpful to have some of these prescriptions that you might use here and there.
Right.
And if you don't tolerate the medicine and you're having to medicate to tolerate it, then it's not the right medicine for you.
Yeah.
But there may be some habits that you have that are making you not tolerate the medicine as
Absolutely.
well. One of which I think is huge is you must hydrate when you are on these medicines. If you are getting headaches while you're on Semaglutide or Tirzepatide, it is largely because you are dehydrated.
Right.
These medicines can dehydrate people. Weight loss dehydrates people.
Right.
Losing fat dehydrates people. So you end up dehydrated. And if you've added exercise or you're doing more, then you dehydrate because of that as well. So you really got to, it's a great habit. You need to stay hydrated anyway. So one of the great things that you can start doing while you're taking these medicines is develop the habit of enough water.
Right.
Enough water. 64 ounces tends to be kind of the number we throw around as a minimum.
Right.
Of course, if you have a medical reason that you can't drink a lot of water, if you have kidney issues, if you have heart failure, then you need to stick with your water restrictions.
Right.
But if you are a healthy person who can drink enough water, then I would say you want a minimum of 64 ounces.
Yeah.
But some of the other rules around like how much water should you have?
Yeah.
You know,
Typically what I'll recommend is about half your body weight in ounces.
Yeah.
So you take somebody who's 180 pounds, you're talking 90 ounces. At that point, your kidneys are happy, your joints are lubricated and things. I certainly have people that walk in drinking, 128 ounces, a gallon of water a day, which is great, especially if you're exercising and you're losing a lot of sweat and things like that. But 64 ounces is usually the minimum that I'll give people, unless they have, heart issues or kidney issues. So.
And if you are hydrated like that, it also really helps make these medicines safer.
Sure.
Because some people will get some kidney intolerance. They'll end up with a little bit of acute kidney injury because of these medicines, but it's not really the medicine that's causing acute kidney injury, it's dehydration from it.
Right.
And so anytime you really dry out, you're going to hurt your kidneys for whatever reason. So if we're using something that creates a issue with dehydration, then we need to hydrate to protect our kidneys.
Right, absolutely.
So hydration is huge. Make sure you're getting enough water in. And if you're having headaches, if you're having fatigue, you may notice that it gets a lot better if you're hydrated.
Absolutely.
Another issue is, what are you eating? There's a lot of these medicines don't tolerate based on what you're eating.
Okay.
And guess what? You're trying to lose weight. We're trying to get you to eat right. So interestingly, the stuff that you should stop eating for weight loss is the stuff that makes you sick on these medicines as well. So fatty foods, like you already mentioned, refined sugars, if you can pull those back in your diet, then a lot of times people's nausea will get a little bit better. Also, when you eat a lot of fatty foods, that's when you're more likely going to get the diarrhea or other things that come from side effects of these medicines. So changing your diet out a little bit, making sure you stay well hydrated. These are basic rules for health and weight loss anyway. Right. But it's going to help you tolerate these medicines better.
Absolutely.
One of the things that people get is kind of that over full or acid reflux. And that we said in a prior episode that the food sits in your stomach a little bit longer. It delays gastric emptying. So if food is in your stomach longer, it can really give you that bloated feeling. And it might kind of reflux up into your chest some. Eating small, frequent meals may help. The more that you put into your stomach and let it sit there, the more it's going to expand, the more it might reflux up. So kind of dividing your meals out, or stop when you're full. You know, I've heard people almost like they're proud of themselves. I ate past the feeling of full. Like, why did you do that? Like, we're trying to get you to eat less. Like, pay attention and stop when you're full. And learn how to stop when you're full, so that when you're not on these medicines, you'll still stop when you're full. But small, frequent meals may help a lot with that bloating and acid reflux.
Absolutely. And I tell patients too, I tell them to think of their gut, their stomach and intestines and things as kind of a conveyor belt. And so when it's moving too fast, you get a lot of the diarrhea and things. When it's moving too slow, it's typically constipation or reflux and things like that. So one of the things that I'll recommend to patients a lot of times is, if you are not on a multivitamin or specifically a B complex and B12, that sometimes can help the gut transit time and mitigate some of those GI side effects. So
absolutely. And I would throw in there, we talk in our supplement episode about probiotics, and I would throw in there a probiotic because some people already have a very unhealthy GI tract. And so if you don't have the good bacteria that help balance things, it's not going to absolutely reverse the side effects of these medicines. But if you're working with the right thing to start, then you're less likely to get aggravated. And so I think making sure that you have some fiber in your diet and making sure that you're using a probiotic is a great way to keep your gut healthy anyway.
Absolutely.
And it's going to help kind of mitigate some of these side effects if you're in a bad place to start.
Or it can repair tissue and help with inflammation that you may have had from, previous bad eating habits or things like that.
Absolutely. So. Another little piece of advice, if you're suffering from the heartburn that people can get from this, certainly you can medicate that. You can do a chewable Tums or other things, and it's not going to interfere or have a negative interaction with the medicine. But also in changing your diet so that you eat sort of a acid reflux diet. So if you Google search diet to reduce acid reflux, diet for GERD, you'll see, low acid foods, not a lot of tomato sauces and orange juice, wine and coffee are high acid. So all of these things are just going to make that heartburn worse. So you can use the medicine, but change out to be more of a GERD diet. And that should help a bit with your acid reflux symptoms as well. Alcohol, for a number of reasons, tends to aggravate the side effects. People will get more nauseous if they are having alcohol. They'll get more dehydrated. They'll have more headache. And so I think limiting your alcohol intake is a good way to kind of counter these side effects as well.
Well, and it's going to help counter, alcohol has, depending on what you're drinking, a moderate to high amount of sugar. And so the goal is to kind of lose weight, decrease calories and sugar. I mean, it's going to help all of that too. So absolutely.
So it improves your habits, and it decreases those refined sugars that can trigger some of the nausea. So there's a number of choices we can make that are going to make these medicines more tolerable. And then there are also some things that you can have on hand, like Tums or ginger, or, ginger can help with nausea, ginger ales. things of that sort. So being able to utilize those tends to help. As we said in prior episode, the nausea and the biggest side effects tends to happen on day 2 to 3 on the once a week shots. And so being able to do some of these things can really help you to tolerate these once a week shots a little bit better.
Yeah.
What about some of the things? So these are, if you're having some side effects, how can we help you to get past the side effects? A lot of people, it's not shocking, but it's sometimes disturbing when people are like, these medicines are making me so sick, but I'm not going to stop them.
Yeah.
I mean, people are desperate to lose weight, and we're not mad at them. We understand what a hard journey it is.
Sure.
But don't take stuff that's making you sick.
Absolutely.
But if you can change some of your habits to be healthier habits anyway and not get sick, then fabulous. Then you may be able to stay on the medicine.
Yeah. I mean, I've had a handful of patients who could not tolerate, maybe their diet wasn't terrible before, and they're doing all the things that we're talking about and still couldn't tolerate it. We just pivot. I mean, there's other things, other avenues we can explore, other experts we can talk to. So, no, I don't want anybody to make yourself sick trying to lose this weight.
No, that is not the way to do this.
Yeah.
And if you're having a lot of vomiting, that's going to dehydrate you even more and create more problems, maybe cause the kidney injuries and things of that sort. So don't think that you're just going to push through. If it's literally making you sick, then it is time to pivot.
Yeah.
I also think that people get a little bit caught up on more is better, more is better. Like we live in a more is better country. I'm not mad at that. I think many times more is better.
Sure.
But many times it is not. And so if you are doing really well on 0.5 milligrams and you're losing some weight, and every time you try to go up to 1 milligram of semaglutide, you get sick and you feel horrible, then stick with 0.5. Sure. Slow and steady wins the race. You don't have to lose all of this weight overnight. And many times if you're doing slow and steady on the lower dose, you're going to do better when you come off the medicine because you've had to develop some good lifestyle. You haven't quieted all the noise with such a high dose that when you come back off of it, you're able to tolerate being off the medicine.
Well, and it's always the flashy stories that that make the Instagram posts or the news, the nightly news and things. I tell patients a very realistic expectation is about half a pound to 2 pounds a week. So if you come in 8 weeks and you've lost 4 pounds, that's a win.
That is a win.
And sometimes it's if somebody completely does a lifestyle overhaul and they're using these medications, you can lose more than that or faster than that. But people need to. I try to manage expectations at that initial appointment of, listen, this is kind of what to expect. If it's more than that, great. But as long as that trend line is going down and you're feeling well, that's what we're after.
That's right.
So.
Shoving up the dose as fast as you can to lose as much weight as fast as possible. Yeah. You don't put it on overnight. You don't need to take it off overnight.
You can cause other issues by losing it too fast. And hair starts falling out. That's another complaint I get. You drop weight really fast. And people walk in and they're like, oh, it's the medicine. And I'm like, no, it's the fact that you dropped 50 pounds in 2 months and, your body's having to play catch up. So
And you can have nutritional deficits that cause hair loss and that cause muscle loss and other things. Because when you go, well, I just shut down my hunger altogether and I can forget to eat for days. Well, guess what, guys? Not eating for days is not good for you.
We need food.
Definitely did not have to go to med school and get all the debt to know that. So make sure that you are just working within reason. Be reasonable. We know you want to lose weight. We know you want to get this whole I got to lose weight thing behind you.
Yeah.
But be reasonable with it. And then let's talk about, if you are, what we know about these medicines is they are a financial commitment. They are not without some financial commitment. If you can get it on your prescription coverage and you're getting it for low cost, great.
Sure.
That's not most people's stories.
Right.
Let's talk about that for, people have been saying, well, why won't my insurance pay for this? What can you do to get my insurance to pay for this? And if we are your doctors, then I would say, please give your doctors a break.
Right.
And if we are not your doctors, I would still say, please give your doctors a break. Yeah. We don't get any control over whether this is paid for or not. And when you go to the pharmacy, they're going to say, well, your doctor can do a PA. For the most part,
it's still going to get denied.
It's going to get denied. Yeah. So in this country, most insurances, especially commercial insurances, they decide whether you're going to have a weight loss rider or not.
Right.
Whether they're going to pay for things related to weight loss or they're not.
Right.
And so they may pay for bariatric surgery, they may pay for weight loss drugs, or they don't.
Right.
And so if it is approved for weight loss, if it is approved with the diagnosis of obesity, morbid obesity, overweight, and they don't pay for weight loss, and Medicare does not pay for weight loss,
right.
and the Medicare Advantage plans follow Medicare.
Right.
It was interesting. I was reading an article that when FinFin over 20 years ago
right.
had all of the issues where it created heart valve issues,
mm-hmm.
and fenfluramine was then pulled from the market.
Mm-hmm.
Medicare made a rule at that time. It went into law, I believe, that they will not pay for weight loss drugs. That is still the law. So although these medicines are nothing like FinFin,
sure.
that is still what Medicare is basing things on. So they won't pay for weight loss drugs.
Right.
And the only way that it gets approved then is if we're prescribing it for diabetes. So if we prescribe Ozempic and you have diabetes, but if you're borderline, they are now, insurance companies, these are expensive drugs. Insurance companies have gotten tighter and tighter on who they'll let have it. And so they are also saying, well, show us the A1C.
Right.
You've got to have, and now sometimes they're saying, and this is frustrating, people have been on Ozempic to get their sugar controlled.
Right.
And then they have a great A1C that's at goal because they're on the Ozempic.
Right.
And then their A1C is fine. We're not going to pay for Ozempic anymore.
Yeah.
And it's like, well, I'll prescribe it again when it's not fine, because if we pull them off of it, we might lose control.
Or they I've had patients who they have to fail certain other medications first, and they get frustrated, and we have to play the game.
We have to play the game. We did not make the game, but we are stuck in the smack center of the game, and we're willing to help people and whatever, because we understand the patients also didn't make the game.
Sure.
But there are more insurances than not that will not pay for these medicines. It is unfortunate also that insurance companies don't tend to think of obesity or weight as costing them money. Most of the time people don't end up in the ICU with an obesity diagnosis.
Right.
But they do with uncontrolled diabetes, or they do with other issues related to weight after a heart attack. But that's not the primary diagnosis, and so they're not, all the actuarials and all the AI isn't saying, well, it's obesity that cost us the most money.
Right.
And so they're going to pay for things that cost them the most money. They're not going to pay for things that they don't deem to cost them the most money. And so insurance companies are a lucrative money-making industry.
Sure.
And so they're looking at their numbers and saying, we're not going to pay for this. So that really becomes, well, if you're paying out of pocket for these things, so either you're buying it at the pharmacy or you're getting a compounded version through a weight loss clinic, then, and again, we really recommend that you do that in a medical setting.
Right.
I will just kind of interesting sidebar to that. There are some stories where people have died from the medicines that have been sent to them from some weird virtual program that will send you semaglutide or will send you tirzepatide, and they sent insulin. Yeah. And if you don't have high sugar, even if you're diabetic, if you don't have high sugar and you take insulin, you're going to a diabetic coma. Yeah. Yep. And so this is not, you can't just get a syringe from a person at the other end of the internet and go, this is probably safe. Yeah. I think we all know better, but we need to be smart about this, and we want to make sure that people are safe. Yeah. But if you are spending your money on this, we also want you to be able to get the most out of what you're doing. And so what are the ways that people can go through these weight loss journeys on tirzepatide or semaglutide and get the most out of it?
I think going back, working with a clinical expert, I think is going to be a huge benefit. Finding a program that's affordable. You and I, we've done a lot of research, a lot of work on the programs that we offer here. And I'm proud of the programs we offer here. I feel like they are very effective. They are very safe. We work with compounding pharmacies that we've vetted. I don't know how many hours I spent on the phone.
Oh, you spent so many.
So many. But it's necessary because we want to keep people safe and help people be successful. And so, have the team around you is important. And in working with that clinical expert, it's going to keep you from doing things that are unsafe, like skipping doses or taking too much medicine too fast. And but ultimately, I think the team around you, and whether it's the movement piece or the diet piece that you're struggling with, and just having all of those resources in place to help you be successful while you're taking these medications.
Yeah, and I think you just have to take the mental approach that this medicine is a part of an entire program, but not the program.
It's a tool in your tool belt.
That's exactly right. Yeah. And you will need many tools.
Absolutely.
You're not getting through this whole weight loss journey with just one tool.
Right.
And so making sure that you are working toward lifestyle change, that you are working toward exercise and having movement be a normal part of your life.
Yeah.
That you, if you have any unhealthy relationship with food, if you have a history of eating disorders, or binge eating or anything of that sort, that you get the mental health to be able to, through this journey, conquer some of those things so that then when you come off of these medicines, you have a healthier relationship with food and can move forward more successfully. Many times while you are on this weight loss journey is the time to really bring in those other clinical consultants and make sure that you have good information that you're working off of, and that you're recognizing that this is going to require some work on your part. This is about eating different. This is about looking at your plate and saying, I need it to have nutrition. That this is what my body runs off of. If I put no fuel in or bad fuel in, the car doesn't run.
And coming into it with realistic expectations, I said earlier, I try to manage those. You can't, overhaul or change your diet, your exercise, the medications you're taking, address your mental health and things all at the same time in kind of the shotgun blast way. And, a lot of times you're not going to be successful trying to have that much change. So I think realizing that it's a marathon and not a sprint.
Yes.
And, just taking it one day at a time, one meal at a time. Make a good decision for this meal. Make a good decision later to go get your walking in or go to the gym or whatever it is. And just, trying to manage people's expectations around these medications, I think is sometimes one of the most challenging parts as a clinician.
I think so. And I think that really helping people understand that making healthy decisions, prioritizing your health is really an everyday wake up and do it again.
Yeah.
It's not like, oh, I made that decision once and then it stuck with me forever. I think I've said on the podcast before, I know I say to patients every day, I equate healthy lifestyle and healthy decisions, whether it's to try to control your sugar, try to control your blood pressure, try to lose weight. I equate all of it to trying to be a good person.
Right.
That churches don't exist because we don't know the rules. That we don't know what good looks like.
Right.
Churches exist because good is hard.
Right.
And we need to get remotivated. Right. And every day we need people that are feeding into us to try to help us be our best self.
Right.
And the same is true when you're trying to make lifestyle changes.
Yeah.
And when you're trying to live a healthy life, you need people pouring into you because it is simply harder.
Yeah.
I don't care if someone tells you otherwise, they are lying.
Yeah.
It is harder to do the right thing.
Yeah.
It is harder to eat right. It is harder to get in your exercise. You have to be committed to it. You're going to fail some days.
Yeah, absolutely.
Every church, every religion says, we're not perfect. Know that you're not perfect. They're already preparing you for you're going to mess up.
Yeah.
And don't give up when you mess up. And that's okay. Have people around you who pick you back up and keep you on course.
Yeah. And, there's, whether it's food and thing, just having those accountability tools, whether it's people or apps on your phone or, so you can track your food or track your exercise, track your medications, track your vital signs, your blood pressure and things at home, just different tools in the tool belt to help people be successful.
Yeah, I think honestly recognizing that the more that you do while you're taking these medicines, the shorter period of time that you'll have to spend money on the medicines, and the better results you're going to get.
Yeah.
And the more likely you are to sustain your weight loss after you stop taking the medicine.
I tell people all the time, then it becomes everybody's favorite part, and that's consistency. And I think that's hard whether you're, an Olympic caliber athlete or a lay person who, is a teacher, is a clinician, just trying to lead a healthy lifestyle. I tell people all the time, if I could bottle or put into a pill discipline or consistency.
Oh, wow. You'd be rich. Yeah. And I'd be your first client. Yeah. So a few different kind of tips and tricks of what we share with our patients when they're on these medicines to help them tolerate the medicines better if they're struggling with side effects. But most importantly, we don't really have a lot of exciting and sexy news on the weight loss front. These medicines work. Yeah. However, you have to work the program.
Absolutely.
You still have to take good care of yourself. This medicine isn't going to take good care of you. You've got to make those good decisions. But you can do it, and we're here to support you in that journey.
And it's worth it.
And it is worth it.
Yeah.
And it is absolutely worth it. And if you don't think it's worth it, it's because you're gifted good health. But when that good health goes away, you're going to be reminded of how important it is to take good care of yourself.
Yeah.
So hopefully some of these tips and tricks help you to be able to get the most out of the Semaglutide and Tirzepatide weight loss programs that you may be participating in. We have a number of other episodes around these medicines to help answer questions, because we know that there is a lot of confusion. There's also a lot of bad information out in the internet about these medicines. And so please go to a trusted medical provider to get your information. And we hope that this has given you a little bit of answers to possibly some questions you have, or some tips and tricks that you can use on your weight loss journey. We like to leave you on a good note. So today's Tell Me Something Good is brought to you by our great friend and employee, Vanessa, who is one of our wellness co-coordinators. Vanessa, tell me something good.
So my Tell Me Something Good is my son Caleb is celebrating a milestone this year. He is graduating from the 5th grade and will be moving on to middle school in the fall. And my husband and I could not be more prouder of his accomplishments.
And we have sons the same age, about to happen in our family too.
Yes.
So bittersweet. They're growing up. They're growing
Yes.
up.
I'm not ready.
Yes, but that is definitely something good.
Yes.
Thank you so much for joining us today. And until next time, take care of yourself.